Okay, it's 11:30. I think we're going to go ahead and get started. So good morning, everybody. Welcome back to Security Health Plan Academy. Today, we are fortunate to have Marshfield Clinic Health System Doctor of Physical Therapy, Katie Stearns, here to teach us about osteoarthritis and how the natural process of aging affects our skeletal joints. Dr. Stearns will share a few examples of some activities that could improve physical function and relieve pain. Before we get started, I want to remind today's participants that you are welcome to submit a question anytime via the chat feature located toward the bottom of your screen. And if we run out of time and are unable to answer your question during today's live event, we'll be sure to address it in our follow-up communication scheduled for later this month. Okay, Dr. Stearns, you are welcome to go ahead and get started.
All right, well, thank you so very much for this opportunity. I really appreciate it. Just a quick little something about myself. I've been here at Marshfield Clinic in Eau Claire for 11 years. All of those years have been working in the chronic pain and spine comprehensive pain program. Majority of my patients are spine patients, anything related from headaches to neck pain or rib, low back, mid back, hips, pelvis, anything that relates to that. I also see a lot of my fair share of knees and ankles and elbows and shoulders as well. So everything everything is connected. So, all right, in order to, wait, that's not what I wanted. In order to talk about and define osteoarthritis, we kind of have to look at other definitions as well. So this slide is just a quick kind of where we're going to go and what I'm going to kind of briefly touch on. So we're going to start with the definition and terminology, and then go from what causes it, symptoms, treatment, and then a couple little take-home points at the end. So, all right. So osteoarthritis, it happens at a joint. So we kind of have to define joint. Joint, this is pretty simple, and I'm, kind of dumbing it down a lot, but a joint is two bones that connect. That's where all the movement comes from in the skeletal system. There are about 206 bones in the human body. There's about 360 joints in the human body, a lot of different joints. And a lot of different kinds of joints. There's classifications of all of them, but no matter what kind of joint it is, there's always going to be some movement in there. Some joints move just a little bit, and some, like your ball and socket joint, is going to have a lot of movement in there. Then in between that joint and the two bone ends, you're going to have a cartilage in between that. We usually say it's kind of your cushion in between your joints. It's a very tough material, but it's a flexible material as well. So osteoarthritis is therefore defined as the wearing down of the joint cartilage or cushion, and also the bones that make up that joint. So, real little note in there, a lot of times my patients get mixed up between osteoarthritis and rheumatoid arthritis. They sound the same. They're actually very, very different. We're going to talk about osteoarthritis. We're really not going to talk about rheumatoid arthritis at all. It's more of a systemic, your whole body is involved. It's an autoimmune disease. Pretty much your body kind of attacks itself. So that's a presentation for a different day. But also some people will my patients will get their x-rays back, and they'll kind of read them, and they're like, I don't know what this means. Degenerative joint disease, wear and tear, osteoarthritis, kind of the same verbiage for this, or different verbiage for the same diagnosis. So it's all the osteoarthritis, or the breakdown of that joint. A lot of different severities. You're going to start with mild, and everyone is going to have some mild arthritis, and then you're going to go to moderate and then to severe. So that'll kind of come back into play for signs and symptoms and treatments as well. So, all right. Causes of osteoarthritis. it's the natural process of aging. So a lot of people come to me and they're all concerned because they have arthritis or they have degenerative joint disease. And I always kind of say, congratulations, you did a great job. You have made the most of life. It is a life well lived. No matter who you are, that's what happens as we age. We kind of get some wear and tear. It's the same thing as on the outside, we get wrinkles on our skin. On the inside, you get osteoarthritis of the bones. Not necessarily a bad thing. Like I said, it's just kind of, that's how we age. So that's one way, is just the natural aging process of every single human being. The other one is trauma to the joint. So you can kind of speed up your osteoarthritis process by injuring a joint. So if you fall on your right shoulder, and it's a significant enough fall, you can have more arthritis in the right than the left. So some people are like, why do I have more? My left hip is just fine, but my right hip is severe arthritis. You probably did more on, sometimes high jumpers or pole vaulters will have more on one side, or paratroopers. I had a patient once who was a paratrooper in World War II, and his whole left side was all arthritis, and he had knee replacements and hip replacements on that side because he always landed on that side. So trauma to a joint will speed up the process, but overall it's that's just how we age. So all right, symptoms, again, kind of this really varies with the mild arthritis to the moderate to the severe, but the number one symptom people find is pain. They have pain in their joints, they have pain in their back, they have pain in their neck. The extent of the pain really kind of depends on the person, the location of the arthritis, other comorbidities that they may have. Sometimes rule of thumb is it's typically more of an achy pain than a sharp pain. Not always. You can definitely have sharp pains for arthritis, but most of the time it's that I get up in the morning and it's ache, my low back aches, that kind of achy pain. Stiffness at the joint and loss of flexibility is also a big one. They say, I just feel stiff. I can't move. It's just achy and stiff. That's a huge, very common symptom of the osteoarthritis. Swelling, if it gets to be more of the severe, moderate to severe arthritis, you can find swelling in the joints as well. And that's going to be more evident with the smaller joints and the more superficial joints, like your fingers, your hands, stuff like the lumbar spine and the joints in your low back. You're not going to see as much swelling there just because there's more tissue around that. But number one, or the three most common, I kind of going back, the three most common spots to get osteoarthritis, I should say, are your weight bearing joints. So your hips, your low back, and your knees are the three most common. You can definitely get it other places, and we see that all the time. But the low back, the knees, and the hips are kind of your big common ones. And then when you get to this kind of the severe osteoarthritis, that's when you'll kind of get the deformity of your joints. Again, you're going to notice that the most in your hands, probably hands and feet, I would say. And then as the joint breaks down, your body kind of tries to help, and it puts down some more bones. So you get these bone spurs and that sort of stuff. So that's where you're going to get the deformity from. Number one would be pain, though. That is by far the greatest symptom that we see anyways. All right, going on here. Oops, wrong one. Treatment. There's a lot of different treatments. Again, a lot of it depends on, is it mild, moderate, or severe? I am a physical therapist, so I'm going to kind of talk more on the physical therapy activity and treatments that we do in PT, but to kind of, briefly touch on the medication stuff. Anti-inflammatories and pain relievers are probably the number one go-to first thing you try. And some people swear by them. Some people say they didn't do anything. That's definitely the most common. A lot of people don't like taking medications, or they can't because of kidney, liver stuff. Then you can go to try some natural supplements. Glucosamine chondroitin is probably one of the most common. Those are two substances that your cartilage is in your cartilage. Your body naturally makes those. So by taking a supplement, you're kind of increasing the lubrication of those joints, which will help with pain and mobility. Turmeric and ginger, both spices that are really known for their anti-inflammatory properties. And then omega-3 fatty acids, which we normally think of fish oil, but blueberries and flaxseed are also two really big ones. So those are more of your natural supplements that can help. Some people, again, swear by those, and some people say not so much. So it really is case dependent. And if you don't want to take any of the natural supplements, or you're on other medications that you cannot take other supplements, then you can change your diet as well. A lot of our foods are inflammatory, meaning they just create more inflammation in the body and the joints. Some of the examples of that would be gluten and dairy, sugar, excess of alcohol, vegetable oils, and then any sort of artificial preservatives or additives, or a lot of processed foods can increase inflammation as well. So that's kind of the non-PT treatments for osteoarthritis, but I really did want to kind of make the point that always talk to your primary care provider when changing or adding medications or dosages or supplements, because they will, or your pharmacist as well. So they will kind of help you with that. So, all right, going on to more physical therapy, kind of my neck of the woods here. So what do we do here? A lot of my patients come and they're in pain, and I don't blame them. And they say, I have arthritis. You can't take it away. What are you going to do for me? And that's a very valid question. We get that a lot, and I think it's a great question to ask. Stretching is, in my opinion, one of the most underrated things you can do for your body as a whole. The human body was meant to move. We weren't meant to sit for 8 hours a day. So I always tell my patients, like the Tin Man from the Wizard of Oz, if he doesn't move, he kind of loses that ability. The more you move and the more you stretch will help, especially with those arthritic joints when they kind of cramp up and you just don't have that mobility in them anymore. So lots of stretching, gentle stretching, nothing too crazy. Strengthening is probably one of the greatest things you can do. It's a hard sell sometimes, because when you're in pain, it's hard to think, okay, she just wants me to go to the gym and lift weights. And that's not what I'm talking about. But when you're in pain, the thought of moving and working out is not usually what you're hoping to hear or do. But I always think of a joint like a joint of a door, or I usually say a treasure chest. When that treasure chest opens, that's the joint there. Analogy that you've probably heard, because it's pretty common and I use as well in the clinic here. But if you think of a joint of the treasure chest, the hinge, I should say, the screws that hold the hinge there, those are like your muscles in your body. So that treasure chest, if the screws are loose on the hinge, you're going to get a lot of extra play in that hinge, and that's going to kind of wear down the joint or the hinge. And let's take the knee joint, because that's kind of an easy one. It is a hinge joint. So if your muscles are not strong and your knee is supposed to just kind of bend, but you're going to get, if those muscles or screws aren't tight in there, you're going to get a lot of extra play in the joint, which is going to break down the joint more. So if you can tighten the screws or tighten your muscles, strengthen the muscles around a joint, it can keep it stable. So it's only doing the motions that it was made to do. It's not having all that extra gliding and play in there. So again, when your knee hurts and you have arthritis in there, really one of the last things a lot of people want to do is start to strengthen the quads and strengthen the hamstrings and that. But it is probably the most effective way to help with the arthritic pain and doing with the strengthening. So kind of along with the strengthening is balance. I give all my patients balance, whether you're 18 or 88, just because it's one thing that kind of, just because of how we age, it's one thing that always kind of decreases. And it really is, we can't have falls because that leads to a whole bunch of other stuff. When you balance, all your little muscles around the joint are activating to hold you where you are, whether it's your foot, your knee, even you can do some, you know, on your arms, and if you're on your hands and knees in quadruped, that balance is going to activate those little muscles around the joint, and it's going to do actually more than you would think. So weight control is kind of an obvious one, but if you think of that treasure chest again, the heavier the lid or the top, the cover of the treasure chest, the heavier that is, and it's opening and closing and opening, closing, it's going to wear those hinges down sooner than later. So just trying to get to a healthy weight will also help with the arthritic pain. Heat and ice, you know, depends on who you talk to. Some say ice, some say heat. Heat, or the inflammation within the joint wants ice typically. The joint is pretty deep in there. The muscles around want heat usually. So sounds like a cop-out answer, but I say if heat feels good, great, do heat. If ice feels good, great, do ice. And some people go between the two. Won't be a miracle cure, but it will definitely help to take the edge off, or it should. Aquatic therapy or getting in the pool is a really nice option if that's a possibility, because of the buoyancy, the property of water, the buoyancy in there. It really takes a lot of that weight off the joint. So you can move the joint, you can strengthen the joint without having all the extra weight on there. So that is a really nice, and you can get a good strengthening and cardiovascular. I hate saying workout because it makes it sound like you have, you know, you're sweating, but in the pool. So super good option if that is there for you. And then finally, kind of our last ditch effort would be surgery. And we see them all the time. I guarantee everybody knows someone who's had a knee replaced or a hip replaced or a shoulder replaced. And that's when it gets to the point that it's just severely arthritic and it's really affecting your quality of life. Then you're going to go, or you could go the surgery route, and you can get an artificial knee put in. So that is kind of more of my cup of tea with the flexibility, or the flexibility and strengthening and all that in the PT world. So let's go. Something to think about, and this is one that I really like, that I think it gives a good picture with the fish. It says, how would you treat a sick fish? There's a lot of different ways to do it. Not just two theories, but this simplifies it. But theory 1 is medicate the fish. Theory 2 is clean the tank. And it's not, life isn't this simple and this easy, but it does kind of give you something to think about. If you medicate the fish with the dirty tank, it can help. It'll help some things, but you're not fixing the problem. You're kind of treating the symptoms. The fish with the clean tank, he still may need medications, and they're necessary and they're great. We're happy to have them, but we want to minimize, they all have side effects. We want to minimize them as much as possible just to improve our quality of life. So that fish might still need something, but he's going to be a lot better off because of it. You get one body and you have to take care of it. And unfortunately, too many people don't think about that when they're young and pain-free, but when you're older, I can't tell you how many times I hear patients say, oh, if I would have known then how I feel now, I would have done things differently. So just something to think about. And just ways to kind of clean the tank and just keep an active lifestyle. And when I always hate saying that, because people think I'm telling you to go to the gym every single day, 7 days a week, and do your exercises. And that's not necessarily the case. That's one way to do it. And I know you've probably all heard this before, but taking the stairs instead of the elevator, going like a graded walking program, just start to go get the mail and come back. And then especially now with spring coming, a little bit of walking outside. It doesn't have to be a lot, or parking at, the back of Target and not trying to driving around for 5 minutes, trying to find the closest parking spot will help too. So just little things add up to be big things. Some of the catchphrases I use, and which are true, but motion is lotion. Keep moving, keep those joints moving, keep the body moving. Motion is lotion and movement is medicine. One of my favorite ones is movement can replace medicine, but medicine cannot replace movement in its entirely. So that's kind of my wrap up. Is the best thing you can do is move. And again, it doesn't have to be, you don't have to go out and run, but just little movements will help with the arthritis, and will help with all the body aches and pains as well. So that's kind of what I have from a physical therapy standpoint of osteoarthritis. So I don't know if anyone has any questions.
Yeah, so thank you so much, Katie. I love the fish analogy. I think that's such a cute way to explain it. We did receive a few questions actually throughout the presentation. So if you are ready, I think I'll go ahead and just ask away.
Sure.
Okay, so the first question I received was, why do my x-rays show severe arthritis, yet happily I have no symptoms?
It's a very good thing. And it's funny looking at x-rays all day long, how you can see someone who their x-rays look horrific. They just look awful. And yet they come in here bouncing and they have no pain. And then sometimes it's just these people are in a lot of pain and there's just some mild arthritis in there, and there's a lot of different factors that work into that. But one is which joints have the arthritis. If they're weight bearing, you're going to feel them more. If you have a lot of arthritis and you really don't have much pain, you probably have some good muscle strength around those joints that are helping to hold it there. I always tell people, and it's not necessarily the actual arthritis that hurts, it's the extra movement which creates the inflammation that is painful. So my guess would be, thankfully, that person's doing great, which is perfect, but probably has some good support around those joints. So that's kind of our goal, is to get you, even if you have severe arthritis, to strengthen around it, and then your pain will improve.
All right. Another person asked, I have arthritis in both my hands. What can I do about it?
That's another good question. Hands are tricky because they're not necessarily weight bearing, but man, do those things work hard all day long. We don't give our hands enough credit for how much they do and how much of the repetition, even at work. Me working on patients or typing or, whatever have you, staying home with the kids, you're constantly using your hands. So they're non-weight bearing, but they play a huge role in our everyday lives. The heat and ice can help for that. Otherwise, and it sounds silly, but I have little kids at home, so this is easy for me, but even just taking Play-Doh and working with Play-Doh and I know you can get fancy schmancy exercise clay or exercise putty, they call it. You can get little hand strengtheners that will help to gently strengthen the muscles of the hand. But just everyday stuff at home, like Play-Doh and puzzles, and just the fine motor skills will help to kind of work those small muscles of the hand. So it's not like you have to do finger push-ups to strengthen them, but little strengthening ones like Play-Doh will help as well, should help as well.
Okay. Anything specific I can do for neck stiffness and pain?
Neck stiffness and pain, yeah. Again, mobility, motion, work some motion in there without pushing too far. More is not better in the PT world and really life in general. So, kind of work towards move your head in all different directions, working towards the barrier, but don't push through the barrier. If you start to try and push through that mobility barrier, you can create some inflammation, and that will just kind of be doing the opposite of what we're trying to do. But heat and heat usually works a little bit better for the neck, but some people like the ice too. So stretches, lots of stretches and motion, and that's going to be probably your best. Sleeping, a lot of people that I see with neck pain ask me about pillows. And it really kind of depends on if you want to think to keep that spine in a neutral position. So if you sleep on your back, you want a really flat pillow or no pillow. If you're a side sleeper, you want your head to kind of be in the neutral position. So more of a fluffy pillow usually works. At the end of the day, it is really personal preference, but those are kind of some tips on pillows too.
That will be a good takeaway for myself. Another question. I get pain in my fingers at night. It comes if I eat nightshade plants, but last night I had pain in my fingers and I didn't eat anything that would have caused it. What can I do about finger pain during the night?
That's a tricky one. Nightshade, there's a lot of inflammation in the nightshade foods and vegetables. One, if it is for sure the nightshade, so keeping like a diary, because there might be something that's sneaking in there that you don't really realize. Otherwise, honestly, and it sounds silly, but putting lotion on at night and kind of rubbing I usually put lotion on at night anyways, but give yourself like a little hand massage all the way down to your fingers. And then if you hold if you have a rice pack or a heating pad or something, you can kind of warm your hands in there for about 10 minutes or so, 10-20 minutes. That may help. But finger pain just at night, that's a tricky one. But I would try that little hand massage with lotion and then some heat and see if that helps a little bit.
Okay, another question we received: how long after hip replacement surgery does the 90-degree rule apply? This person had surgery in 2020 and they are still very careful when lifting the leg on the surgical side.
Okay, do we know if this is a total hip, a posterior approach or an anterior approach? Because that kind of depends a lot on that. Did they say?
They did not say, but why don't we come back to that? And if this individual wants to message me back and specify, that'd be great.
Okay.
So another question: are peanut oil, olive oil, avocado oil, etc., are they all considered vegetable oils?
No, and oil, that's a tricky one. And I know a little bit about this just because I have some kids that have some food allergies, but by no means am I an expert in all the food stuff or the oils specifically. But some oils have more like free glutamate in there, which is inflammatory. And then some, work better at, and I'm no chef by any means, ask my family. But sometimes some works better at a higher temperature and some don't. So I don't know the exact answer with that, but they are not all created equally. I know some, like my kids tolerate some a lot better than they tolerate others. And some are more inflammatory than others. So I'd have to look more into the specifics of which oils, but I do know that some will be the body handles better than others in regard to inflammation.
Okay. Another participant submitted this question: can you overdo movement or overwork joints?
Yes, you can. Rarely do we see that. So, you can. Probably the biggest time I talk about this with patients is with runners. When you run a lot, you hear people say it's bad for your knees. I don't know, you'd have to be running a lot, like multiple marathons a year. And even with that, some runners are just, their body was biomechanically built to run. And then they will be just fine. Let them run all their marathons and they won't have any issues. Some people biomechanically, with their feet sometimes turn in and they have flat feet. Some people just aren't really as biomechanically set to run. So their joints may kind of wear out faster with exercise or specific kinds of weight bearing exercise. But as a general rule, I have very few patients and family members and friends do I ever have to say, you're doing too much. Back off a little bit. It's far more common to be like trying to encourage people to move. So is it possible? Yes. Rarely do we have to worry about that though.
Okay. And I think I'm going to sneak in one last question before we close. But the question is, can you speak to nerve pain caused by osteoarthritis in the spinal column? Would you recommend the same kind of exercise?
That's a great question. And me being a spine therapist, that's kind of I get excited at stuff like this and telling stuff like that. But yes, when you get arthritis in there, it can wear down those vertebrae. And when the vertebrae wear down, your nerves are coming out of those little tunnels. So you can start to get pinched nerves, or even if the nerves aren't pinched, you get inflammation. And if the inflammation touches those nerves, you can get that nerve pain. So any sort of extension, or when you're back bending, is going to close those tunnels down more, which is going to give you more leg pain or more nerve pain. Flexion based or forward based exercises are going to open those tunnels or those foramen as much as we possibly can. So we usually do promote more of flexion based exercises versus extension based exercises, if that makes sense. So yes, depending on, just in regards to the spine, depending on what kind, back pain does not equal back pain, does not equal back pain. There's lots of different kinds, and there's different avenues of exercises that we go down depending on the pathology that you have. So with the arthritis in the spine pinching the nerve, we do more of a rotation away and forward flexion to kind of, and do more exercises in that plane to take as much pressure off that nerve as possible.
Great. Well, I think with that, we can go ahead and close. Thank you, Dr. Stearns, for joining us today. We really appreciate it. I loved your presentation, and I'm speaking on behalf of our audience. I think they probably did as well. So with that, we will go ahead and close, and thank you everybody for joining, and be well.
Thank you so much.